Hello and welcome. Hospital beds and mattresses. One simple way that a difference in technology shows is in the types of beds and mattresses that are used in hospitals or healthcare settings. I'm going to be talking about those different kinds of beds that are used over here. So essentially, there are three main types of beds. The ones that are manual, the ones that are semi-electric, and then the ones that are fully electric. So these beds have a different range of features, from the simple ones to um, should I say more specialized or complex ones. So of course the ones that are very specialized are fully electric. So the features, I'll just run through the features. The beds can move up and down. That's, you can raise the bed up and you can make it go low. The beds have sections: the head side, the middle side, and then the foot side, and you can move each of those sides also up and down. The specialized one, you can do a Trendelenburg position, that's head down. You can put the head of the patient down, you can put the foot down, that's reverse Trendelenburg. Anyhow you want to, you can make it a cardiac, make it like a seat, a cardiac position. You can move it side to side, you can move it this way or that way. So different features like that. Then some of the beds have extensions for taller people. If maybe the person is very tall, it can be extended. Then there are specialized beds like bariatric bed for people who are bigger. So, and then the beds have adjustable side rails. So the side rails, some of them can be adjusted up and down. Some of them can be put at a 90-degree to support the patient when they are trying to move. And then there are bed controls to move it up and down. There's a side the patient can use and there's a side the nurse can use also. Then these beds have wheels so you can easily move them. And then they have a footboard and a headboard. Some of them can be removed, especially ICU beds. ICU beds are specialized beds. They have a lot of features. Some of these ICU beds are motorized. That means you can drive them. Some of them have features like vital signs monitoring. They have IV poles attached to them and hooks so that all the monitoring gadgets can go on the bed and the patient and you move them as a unit. So that's it with the beds. Now let's move over to the mattresses. For the mattresses, there are also different types. And the idea, the main technology in the mattresses is to help redistribute the patient's weight and improve circulation so that the risk of bed sores will be reduced. Now, these mattresses come in different types. There is number one, the air mattress. This air mattress, it kind of redistributes the pressure of the bed so that the patient can somehow move, and it improves blood circulation so that to reduce the risk of bed sores. Then there's the foam mattress. The foam mattress, it contours closely to the patient so that it alleviates pressure on different points, on the different points, pressure points on the patient. So it moves it around rather than the patient staying just in one place. Then there's the inner spring mattress, which is mostly used for patients that are mobile. So this inner spring mattress is kind of more traditional, it's older. So it is, just like I said, is mostly used for patients that can move themselves. Then there's the hybrid. The hybrid is a combination of the feature of the foam mattress and the air mattress. Then there is also the gel mattress. This one regulates temperature and distributes weight so that to reduce the risk of bed sores. Then there is the alternating pressure mattress. This one inflates and deflates, thereby, kind of moving the patient and also reducing pressure. Then there is the low air loss mattress. This one keeps the patient dry, especially patients that sweat too much. Moisture is one of the factors that contribute to skin breakdown and bed sores. So this bed low air loss mattress, it keeps the patient dry and regulates moisture. Then there is the lateral rotation mattress. So just like the name implies, it moves the patient side by side, for the same reason. Then there's the sand bed, or sometimes you hear them, I think depending on the company that makes them, it's called Clinitron, it's also called Envela, it's also called fluidized mattress. This one is a specialty mattress, and what it does is that it creates a fluid-like state on the surface of the mattress, which reduces pressure, reduces friction, reduces shear, heat, and moisture. This is mostly used for burn patients and other patients that have high risk of developing bed sores, such as paralyzed patients. Another specialty mattress is bariatric mattress. So there's bariatric bed and there's bariatric mattress. So this is also a specialized mattress to help patients that are on the bigger side. I'll stop here. Thanks for listening. Make sure to like, share, subscribe, and follow for more.